Fetal Care Center is actually composed of multiple specialties. It's a multidisciplinary care for moms who come with issues with the baby. So it includes the maternal fetal medicine specialist and specialties that will take care of the baby after birth: pediatric surgery, neurosurgery, ENT, plastic surgery, orthopedic, name it.
I am a pediatric general and thoracic surgeon here at Riley, and I care for the whole range of pediatric patients. I'm just one of the people that is working from the postnatal surgery side to help develop what we do. And then this blue image right here below it is the diaphragm. This diagnosis is called congenital diaphragmatic hernia, and it's one of the most lethal diagnoses that we can see in children. And what basically happens is, for some reason, we don't always know why, the babies are developed with a hole in the diaphragm. So that means there's nothing separating the abdominal contents from the chest contents. So then what happens is the intestines, the small intestine, large intestine, stomach, spleen, and even part of the liver can all come up into the chest.
One very important organ for the baby to be able to survive after birth is the lungs. So when there are structures that not supposed to be in the chest, passed into the chest, that will take some of the space and prevent the lung from growing as it should. Our team has already been doing an amazing work in counseling these patients. We have these multidisciplinary care conferences where we bring the parents, their family, all the physicians who care for these patients, and the radiologists, and they open the MRI on that big screen there and show them the images to have a better understanding. So this is already an amazing work. But then me and Dr. Brian Gray, we and the whole team really are very passionate about counseling. We can see the satisfaction in patient eyes when they understand more and better. So virtual 3D printing is, whether it's virtual or it's a printing actually, is really, in the past few years, have come very handy in patient counseling. I reached out to the 3D printing labs, and then we started talking about the model and building the model. Dr. Brian Gray joined us to give his expertise.
Dr. Mustafa and I worked with the artists here with lots of different ideas. We went back and forth about it, how to make, this a little bigger, this a little different, let's change the colors so that we can make it as real looking as possible.
I basically took a virtual ball of clay and I used virtual tools to mold it into the shape that I wanted. That's basically what we do. And then what we did a little bit on top of that is we used texture. So we created the digital assets, had the doctors approve it, put it online, and then basically delivered it through an email.
I think it's really invaluable to be able to use technology that's all around us, but then able to specifically design something that allows us to completely tailor it to whatever we want.
I think it's a great resource for Indiana University and Riley children. Not all the universities have that facility and expertise in building these models. So having them and being able to build such a complicated models, we actually are working on other models other than CDH, all very complicated, all not introduced into the clinical practice before. So I think it's definitely an amazing resource to have.
There's a lot of technology out there, and you can use it for good. And it makes me happy to know that we can help guide the clinicians to provide a solution to the problem that they see.